Hi, my name is Vikram Krishnasamy, and I'm an Epidemic Intelligence Service Officer at the CDC in Atlanta. Last summer, the Utah Department of Health and the Arizona Department of Health notified us of an outbreak of Shigatoxin E. coli, or E. coli 0157 infections in a rural community on the border of Arizona and Utah. This outbreak was particularly severe because it primarily affected children, with a median age of 3. So these were very, very young children. Additionally, 4 of the individuals, or 4 children, came down with a disease called hemolytic uremic syndrome, which is a particularly severe complication of E. coli infection. And further, 2 of those individuals died. CDC, together with the Arizona Department of Health and the Utah Department of Health, as well as local health departments, investigated this outbreak. Ultimately, or initially, we identified 12 cases, 7 that were primary and 5 secondary. E. coli outbreaks typically are the result of contaminated meats or fresh produce. They can also have person-to-person transmission. Initially, when we were investigating the outbreak, we asked all of the individuals of potential exposures. We initially were concerned that there was beef exposure, and as a result, we initially indicated that individuals in the community should not eat beef. After further investigation, using a number of methods in collaboration with local and state health departments, as well as federal agencies, we were able to initially identify that beef was likely not the culprit. After further investigation, we became concerned that exposure to animal manure was a risk factor for illness. And as a result of that finding, we started to do contact tracing, or to figure out what interactions happened between cases and patients in this investigation. After doing that investigation, we identified potential interactions between a number of individuals that fell ill during the investigation. And as a result, we became more and more confident that the initial illness could have been a result of exposure to that animal manure, which then spread by person-to-person contact through the community. E. coli, as we said earlier, can be a result of contaminated foods, but also can be the result of person-to-person transmission. And this case, or this outbreak, highlights how that can actually happen. We left the community with several recommendations. The primary recommendation was that individuals should be very, very careful around animal manure, especially because oftentimes you're not sure whether E. coli exists in that manure or not. Individuals were encouraged to undergo hand washing or to practice hand washing at any time, or any time they were exposed to manure, or any time before consuming foods after being exposed to manure. Ultimately, when we left the community, there were no further illnesses. And as we monitored for several weeks after we left the community, we were unable to identify further illnesses. The take-home message from this investigation is that E. coli remains a risk factor, or an issue in the communities around the country who are exposed to animals and cows and horses. And it's important that folks in the community understand that, as well as ensure that they wash their hands and to minimize the risk of becoming infected with E. coli. Thank you.